Hi everyone, I'm Gerry Taylor. I'm the Director of Public Health for Sunderland. It's really good to see that we're all getting out a bit more, which is great news. But we know that COVID is still circulating in our communities. So this week, I wanted to take a few moments to talk about how important testing is in our fight against this virus. There are two types of tests, and I'm going to explain how and when they should be used. An LFT test or self-test is the test you should use if you don't have any symptoms. These tests are important because 1 in 3 people have COVID but feel fine. So the tests help to find people who could be spreading the virus without knowing it. You can pick them up in places like pharmacies, or your children may bring them home from school. You can even get them delivered to you. If you haven't done a test before, you can also book an assisted test at one of our local assisted test sites first. The second type of test is a PCR test. These tests are for people who have symptoms or are advised to take this type of test. If you have any symptoms, or if your self-test is positive, it's very important that you self-isolate immediately and book a PCR test. Self-isolating means you and everyone you live with must stay at home. It's really important that you do not leave your home for any reason, or you could risk infecting other people. You'll be advised what you need to do once you get your test results. And if you need help to isolate, we have advice on our website, or you can call the number on the screen. So my message to you this week is to test, even if you've been vaccinated, as it's still possible to carry and pass the virus. If you haven't got symptoms, you should test regularly, twice a week, to check that you're not carrying the virus. If you do have symptoms, you should self-isolate straight away and book a PCR test and stay at home along with everyone in your household for the entire time that you're advised to do so. If we all test and isolate when we need to, take up both of our doses of the vaccine when it's offered, and continue to follow hands, face, space and fresh air, we will keep infections under control in Sunderland.